Hello, I'm Dr. Maureen Markman from City of Hope. And what I'd like to do on this session of Minutes with Markman and the next several is to talk about a few ASCO 2025 abstracts. On one hand, this is really a daunting task. I mean, there are so many abstracts at ASCO, so many important abstracts, new drugs, heard about these things, multiple press releases, etc. So it's very difficult to do justice in a few segments, a few minutes to cover ASCO. But what I thought I'd do is pick four very specific abstracts that had nothing to do with drugs, but have a tremendous amount to do individually with not only where we are with oncology, but in my opinion, where we should go. And these abstracts probably don't get, in my opinion, the attention they deserve for a variety of reasons, one of which is that there's no pharmaceutical company sponsor. So here we go. So the first paper on this segment I would like to discuss is critically important abstract, and it's entitled Patient-Reported Outcomes in Locally Advanced Cervical Cancer, Insights from the Outback trial. So let me say first, the importance of this type of analysis simply cannot be overstated. The study itself is well known to the gynecologic cancer community, with the primary results having been reported some time back. This was an open label phase 3 randomized trial involving 919 patients with locally advanced cervical cancer, with a primary efficacy endpoint being to look at the potential benefits of adding adjuvant chemotherapy following completion of what has been standard of care chemoradiation, standard of care for 20 years in the management of this patient population. Bottom line here was the addition of the adjuvant chemotherapy after chemoradiation added toxicity, but no improvement in survival. However, this follow-up study, which I would argue should become standard practice, not only in the gynecologic cancer arena, but in randomized phase 3 trials that are looking at survival outcomes, and what should be standard practice is patient-reported outcomes. So this was a prospective examination of patient-reported moderate to severe symptoms at baseline, and then 1 to 3 years post-randomization. Also the duration of symptoms, as well as the long-term psychological sexual health of the women who are managed with this strategy. I cannot emphasize again enough how important this is. Yes, these patients benefit from this therapy, as we've known for a long period of time, but what was the outcome that they report to the impact on the quality of their lives? Of interest, there was a 94% completion of the survey at baseline, 64% at 1 year, and 37% at 3 years. So obviously, a number of patients decided 3 years they didn't want to report any longer, a variety of reasons. Potentially can be speculated, but clearly in the future, I would hope that we would actually do better with the long-term reporting. Of interest, 50% of the patients at baseline said that they were worried about their future health. At 3 years, 36% of patients still said they were concerned about their health 3 years later, and only 10%, as stated by the patients, did this concern that they have with about future health actually resolved during this period of time. Other questions that were addressed, and about a third of the patients said this remained problematic. They had trouble sleeping, feeling tired, sexual activity was not enjoyable, they had pain, they were dissatisfied with their body, They had financial difficulties, frequent urination, changes in bowel habits. The point being that these were relevant concerns to these patients up to 3 years later. Now, clearly, these patients were alive, they had advanced disease. The important point about these patient-reported outcomes is not to say you shouldn't do the treatment. And it certainly in the future wouldn't be to say a drug shouldn't be approved if it improves survival, but to let the patients, future patients, know what the potential experience would be for them. The downside as reported by previously treated patients, not just some check of a box by a research nurse or a doctor, but what the patients actually reported. The importance of this, in my opinion, as we move forward in the oncology arena with clinical trials and clinical strategies, particularly when there are potential options available for therapy. What did patients experience a year, 2 years later becomes increasingly relevant. And I thank you for your attention.